Hi, it's Sunday the 28th of July and I'm going to I'm going to reflect on day 5 of the inquest into the death of Maeve Boothby-O'Neill. So day 5 was Friday the 26th of July and I was unable to attend the inquest at all on Wednesday or Thursday of last week, so that was day 3 and 4. So I can't... It's a real shame because I understand that Dr. Weir, who was a private ME CFS specialist that the family brought in to support Maeve, he gave evidence on one of those days. So I'm sort of kicking myself I couldn't attend because it sounds like that was really important. But we heard a bit about his involvement on day 5, so I'll be able to speak to that, going from the notes and things that Dr. Julia Prague said about him and his involvement. So it's all really interestingly. So day 5 we had Dr. Let me get the name right, Dr. Kashyap Patel and Dr. Julia Prague giving their evidence for the inquest. Now, both of these consultants were involved in Maeve's care, in her hospital admissions to the Royal Devon and Exeter Hospital. Now, their specialism, both of them, is endocrinology and diabetes. All right, and they both worked on the Lowman Ward. So this is important, this detail, is the Lowman Ward is for those who have trouble eating, but the trouble is not of a gastrointestinal cause. So examples of people who are on the ward include those with a fear of choking, fear of vomiting, fear of weight gain, or, as Dr. Julia Prague said in Maeve's case, fear that if she ate things, it would make her ME worse. And we're going to return to that quite important point in due course. So the morning session, we had Dr. Patel answering questions. All right, so I haven't got a lot to say about Dr. Patel because actually he came across really well, particularly in comparison with Dr. Prague in the afternoon. So Dr. Patel indicated his own lack of knowledge and understanding of ME, but repeatedly demonstrated through his answers, but also notes, and his actions during this period of caring for Maeve. He repeatedly demonstrated how he turned to those with expertise for help. So, for example, Dr. Patel was the one to bring in Dr. Strain, who I spoke about in relation to day 2, who was giving evidence on day 2 of this inquest. So Dr. Patel spoke about himself, I thought really, really persuasively, as seeing himself as an advocate for Maeve, whose case he described as a very complex and outside of his expertise. That's important, again, when I come to talk about Dr. Prague, right? So having said that he acted and spoke repeatedly about how Maeve's case, ME, is outside of his field of expertise. In fact, he demonstrated with his decision-making and the things he said, actually quite a sensitive grasp of the importance, for example, of pacing. So he was saying that actually the care of Maeve is really particular because you can't just go about caring for her by saying, well, we're going to give her a wash, right? So Dr. Prague talked repeatedly about how it would do Maeve good to, wash your hair and have a wash. It would perk her up. It would cheer her up, right? It would make her feel better. Now, with any kind of normal, physiologically normal patient, you'd be going, yeah, absolutely, absolutely. Completely get you thinking. But where Dr. Patel was far more sensitive and nuanced in his engagement with Maeve is that he grasped that, in fact, you can't do that, right? So for Maeve, actually having a wash might, for that day, only be able to be washing her right arm, because that's all she can cope with, right? So he was indicating, despite his professed lack of knowledge and expertise in the treatment of ME and the physiological sorts of processes that go along with ME, despite all that, he demonstrated a sensitivity to her. And also something I'm going to flag up in relation to something that Dr. Patel said is he said repeatedly how any medic is always reassessing. Yeah. Which is fab, which just strikes me as sensible. And again, there's just a really stark comparison with Dr. Prague here in the afternoon. Anyway, so I think notably Sarah Boothby in her questions, so she asked Dr. Patel questions, and at the end of her questions, she thanked him for his care. And she said, quote, "You were a very good consultant." And certainly he came across that way. I would want Dr. Patel looking after me if I went into hospital, really would. And then crucially, and again, I'm raising this because it's in stark contrast to the afternoon's witness, is when asked what he would do differently if he were to care for another severe ME patient, he said, quote, "I think we all learned lessons from our experience with Maeve," right? And it just again keys into the fact that they're always reassessing. And he spoke about he would follow any guidelines that were given. And I think, and this is very similar to Dr. Prague. She was sort of following guidelines. I think the difference is that she didn't always understand the guidelines. That came across very strongly. And when she didn't understand, she didn't turn to experts for their, input, right? Whereas Dr. Patel did. So that's all I have to say about Dr. Patel. Dr. Julia Prague, another consultant endocrinologist and looking after people with diabetes on this Lowman Ward. Now she sort of confessed, very, very upfront, said that in relation to ME, her knowledge and understanding of ME, that she's aware of the condition. She couldn't remember when asked if she or had had any training at all in the condition while at med school or subsequently. She said there might have been a lecture on it at med school, but she couldn't say for sure. But she said she was aware of NICE guidelines. Right, so yep, she's aware. Whether or not she understands the NICE guidelines is another question, right, that Sarah Boothby raised beautifully at the end. Sarah Boothby is Maeve's mum, right? So, where to start with Dr. Prague? It's probably a good thing that I've had a couple of days since listening, a day and a half since listening to Dr. Prague's evidence, because I found it extremely troubling and I was quite upset with her. And I can say categorically that I would not want her anywhere near anyone who had ME, ever. So one of the things that troubled me a lot about Dr. Prague, and I have no doubt she's a great doctor, right, with normally functioning physiologically in terms of metabolism, sorry, my language is all over the place there, but I've no doubt that with, your normal population of people who are sick, right, she's great. Just not with an ME patient. So what was coming through very powerfully for me listening to her evidence is that she was working with Maeve, coming out of a narrative of progress, of improvement. This was framing every single, it seemed to me, interaction with Maeve. She could not understand Maeve's trouble with buying into that narrative of progress, of improvement, right? So when Maeve complained she had lost her suck, we spent quite a long time at this period within Maeve's stay in the hospital, and I honestly can't remember. I think it was the second admission, May into June of 2021, but I can't say that for sure. It's one of the admissions, Maeve lost her suck, right? So Dr. Prague, in response to this, said, "We were only asking her to manage what she has been managing at home." And when Maeve said she was worried that she'll continue to deteriorate, Dr. Prague said, "All she has to do is continue as she has." I don't know where to start with that. Here's a young woman who from age 13 until 26, 27 had deteriorated. That was her narrative, right? So when you have a doctor, a consultant, who is the primary carer of Maeve, saying all she has to do is continue as she has, you're like, seriously? Who are you? Who are you? And what? I mean, for me, this was actually actively abusive care. It was actually abusive. This is why I was so upset. I'm surprised the family didn't completely lose their shit with this doctor, because I swear. Dr. Prague also said all that Maeve has to do is trust us. And that Maeve's improvement, quote, involves her helping them in treating her. I mean, I don't know where to start with that. It was implicitly coming through very powerfully was this sense, right, that Maeve's deterioration was really her own fault, because twice Dr. Prague talked about how the block really was Maeve's fear of eating and that it would cause her deterioration. Now, this is not what's come through very strongly through all the evidence I've heard, is that this wasn't some like fear, right, that wasn't based in 13 years of deterioration, right? So you imagine if you've had half your life, the latter half of your life has been characterised by deterioration, by the systematic loss of capacity. And I don't just mean, oh, I used to be able to run marathons and I can't now. I mean not being able to sit up anymore, not being able to swallow anymore. So, and also, and I can't remember where I heard this, what day of evidence, who I heard this from, but I'm sure at some point in the evidence, I heard that, in fact, consuming any kind of fats or protein, even in liquid form, had demonstrably worsened Maeve's condition historically, right? Which is why she stopped eating. And I'm pretty sure it was described at some point that it caused a kind of, I don't know if it's a weakness or full paralysis of her limbs, but it was pretty stark, the deterioration, right? Also, I think it's worth bearing in mind that my understanding is, I think I'm correct in saying that I picked up somewhere in the questioning, is that Maeve's deterioration started when she was under, significantly. Her decline was pronounced following her engagement with the CFS service, and her following their protocol of graded exercise therapy. Now, this therapy is basically working on the premise, which is great for healthy people. This works for healthy people. I used to be a fitness instructor, so I know something about this, right? Is that you gradually increase the kind of the scale and difficulty of exercise in a person, and your body in a healthy person becomes stronger, right? In terms of endurance, but also strength. So that used to be that kind of graded, again, working out of a narrative of progress, right? Which works for most people. This was the along with CBT, the response and support for ME sufferers. Now, Maeve did that, and it prompted a decline in her condition. It worsened her ME, symptoms. Now, we all know this now. We all know that this graded exercise therapy was founded upon a highly flawed, dangerously flawed major study, right? That was called the PACE study. And it's been completely undermined, right? And critiqued the hell out of. So anybody who knows anything about ME knows that, except Dr. Prague, who's working on a basis of let's continue to see these improvements. And really, so what other things did she say? She said, come on, me. Oh, I've lost it. Anyway, you get the message, right? There's also coming out of this. So when Maeve, I think around the time that she was really, losing her capacity to suck, and she needed, I think that was kind of when the syringe feeding was coming in. Dr. Prague explained to her that, well, the nurses is too busy to give you any kind of feeding at night, because this is again something that Maeve needed. She wasn't able, she didn't have the energy, right, to consume her 3 main meals a day. She doesn't have the energy to do that, so it had to be, my understanding is it had to be much more kind of small and paced feedings. And yeah, Dr. Prague told her that you can't expect the nurses to give you syringe feeding at night. They're too busy to do that. And for me, there's a real cruelty to that. I find that certainly the way that Dr. Prague explained that and read out her notes, it felt to me cruel and abusive. Now, Maeve, I'm just going to give you a sense as well of Maeve's own writing, right, which was read. And I don't know, I'm going to read 2 paragraphs, and I'm not sure which came first in Maeve's original letter. She wrote this, Maeve, in January of 2021, I think when the decline, really started to fall off a cliff. So she, and I'm paraphrasing, I can't, I'm not that fast a typist, so this was me paraphrasing. Maeve talks about how frightening her experience was. She uses the word frightening. And then she said along the lines of, the only treatment, and and I'm not sure what treatment she's referring to there exactly, but she says it's not working. Oh, that's right. So it's frightening when the only treatment you're getting isn't working and you're getting worse, not better. So again, this keys into this kind of, the whole narrative goes of medical care is if you follow medical care, you're going to get better. And this was frightening for her, that it wasn't working for her, and that the medical, services, healthcare professionals weren't, all their interventions were not working. Can you imagine how terrifying that is? So she talks about how no doctors can help you. They don't know what's wrong with you. All you can turn to are quacks and blogs. Nobody has benefited, anybody with ME, nobody with ME has benefited from graded exercise therapy. And in fact, she talks about how her decline precipitated from it. She calls for biomedical research. It must be done to find out what's happening to our bodies to help us to get better. My only hope, she writes, lies in biomedical research and adequate funding. She then puts behavioural treatments cannot help ME. And again, that keys back to cognitive behaviour therapy, which was the other primary treatment. Way to go in making ME patients feel like it's all in their head. She also writes, I've been tired since I was 13. I had hoped I would get treatment and be helped. I wanted to contribute to human flourishing. She talks about how she had to reject all Russell Group uni offers, how she was determined to be a good patient at the MECFS service. She talks about how in her letter she rarely had energy for CBT and how physical stamina was the wrong paradigm and that it wasn't her feelings or attitude that was the problem. And I think this is where I really have the problem with Dr. Prague, because there's these two references to Maeve's fear of eating being the problem. Oh, Dr. Prague. So, Dr. Prague was asked, was hospital a good place for Maeve? Her answer, again, was quite revealing. She said, obviously, if there were limitless funds and you could afford a private room, quiet, low light, no sound, no busyness, no chaos that you see in normal hospitals, then, of course, the hospital stay wouldn't be ideal. You'd prefer that limitless fun context. But then she went on to say, Dr. Prague, that otherwise, hospital is a really important place. And her example for why hospital is a really good place is that if you have a broken leg, you need specialist care. Again, I hope that speaks for itself, because an ME sufferer is not somebody with a broken leg. The whole point of this question, which she completely didn't see, was that an ME sufferer is not a normal person with a broken leg, right? So we're coming on now. I'm going to develop out of this point. The issue for me is that Dr. Prague treated Maeve, framed her in her engagement with her as a physiologically normal patient, right? So she kept talking about the risk-benefit analysis that she was continually engaging in, all right, as she treated Maeve. And this is something that Dr. Patel had talked about in the morning as well. I think the very striking difference between the two is that Dr. Patel recognised at a fundamental level that he was not the expert to be able to engage always with any accuracy or efficacy with that risk-benefit analysis, which is why he turned to experts. So when Dr. Prague repeatedly talks about risk-benefit analysis, the issue is that she's weighing that up based on normal physiological patients. At no point did she stop and think and act in a way that indicated that she didn't have all the facts and information to enable her to conduct that risk-benefit analysis in anything like an authoritative, persuasive way. Right? She couldn't see that. How is she a doctor? She referred to how a conversation with Dr. Weir. Now, Dr. Weir was the CFS ME specialist that the family brought in to help support Maeve. Dr. Weir wanted to talk to Dr. Prague. I'm not quite sure how that conversation came about. I imagine it's because of communications between Sarah Boothby and Dr. Weir. I'm guessing, but I don't know. So he reached out to Dr. Prague. Dr. Prague responded to that request. Now, Dr. Weir was trying, I think, to persuade Dr. Prague to consider some kind of NG, nasogastric tube feeding, or else NJ feeding. I don't even know what that is, but it was, and I lost track of which term they were using and when, but some kind of feeding to support Maeve, right? Because she'd lost her suck. Now, Dr. Prague was challenging that notion that she'd lost her suck. She kept saying, well, she's still using all the muscles when she's breathing and, and talking. So there's no reason, the implication was there's no reason she shouldn't be able to suck. So there was this kind of disbelief there that was coming through. She was also talking about, I think really persuasively, how invasive that kind of feeding, tube feeding is, right? And the risks of aspiration. And then pneumonia, some kind of pneumonia coming out of that, the risks of that. And I think what Dr. Weir, that conversation, and again, I missed Dr. Weir's evidence the other day, but coming through the notes and questioning and Dr. Prague's answers, is that Dr. Weir thought that risk-benefit analysis weighed in favour of tube feeding. And as part of his, what he was saying to Dr. Prague on the phone, is he was saying, actually, he'd like them also to test for Maeve's cortisol and also take account of Maeve's anaerobic metabolism, right? So the build-up of lactic acid. Now, anyone who has done any kind of fairly superficial reading, research into ME will know that it's very common that ME sufferers have issues with their adrenals, right, with cortisol. That's fairly well known. It's also well known that anaerobic metabolism is engaged, right? Because there are problems with energy production, right? I don't know the ins and outs of all of that, but I do know it's an issue, as well as mitochondrial dysfunction, as well as I learned from Dr. Strain, microvascular dysfunction. So you have all these things that are fairly well established. So Dr. Weir on the phone to Dr. Prague is trying to explain these things. And so, as we were finding, obviously disagreed with Dr. Prague, who felt that the risk-benefit analysis was basically precluded this kind of tube feeding, right? So they were in disagreement. But Dr. Prague apparently went back and told Maeve that Dr. Weir and she were in agreement that tube feeding was not appropriate. So that's not entirely true. So you kind of go, okay, I can start to see how trust started to break down. Then we also have, come on me, my brain, I do have mild, thankfully, ME, so my brain doesn't always behave. So forgive me just for a second. I think I'm just going to come on to my next point, which is that Dr. Prague, in her notes, described Maeve as manipulative twice. She was asked about this, and Dr. Prague said, I can see how that language might kind of read troublingly. But you've got to understand that when Maeve was admitted, I think this was her second admission, the ward manager told me to be on alert for Munchausen by proxy in relation to Maeve's mum, Sarah Boothby. And actually, so my notes regarding Maeve as manipulative should be read in the context that in fact Sarah Boothby is generally, and I am absolutely paraphrasing here, right, but it's generally kind of, engaged and listening and trustworthy, and actually there's no hint of Munchausen by proxy according to Dr. Prague. If there's manipulation anywhere, the implication is it's Maeve. Now, I didn't buy this. I didn't buy it for a second. And actually it took me a while to go, that's very specific language, manipulative. And then it occurred to me, of course, Dr. Prague is working on a ward that sees a high number, relatively high number, of patients with eating disorders. And the manipulation around food, I would imagine, is fairly common with, let's say, anorexic, sufferers of anorexia. So, and it also, this notion of manipulative indicates to me, because that just strikes me as quite, well, that's, it carries fairly negative connotations, doesn't it? The word manipulation. It's not like, Maeve, I don't know, any other numbers of, language, of vocabulary could have been used there rather than manipulation. But it indicates a breakdown relationship, in my view. And I have to say, having heard everything, I'm from Maeve's side and Sarah Boothby's side, I'm not surprised there was a breakdown in trust, to be perfectly honest. Then, strikingly, when Dr. Prague was asked, would you do anything differently again? Guess what she replied? No. And I think, I don't know where to start with that. How does a doctor not critically reflect on what they've done and how they've behaved, and think how can they not, if they're a good doctor, reflect critically on their own actions at any point, even with a successful outcome with a patient, right? Let alone if that patient has died. How can you not reflect? I don't know what to do with that. And I think just the last point, the point that I was trying to remember just now, is that Dr. Prague talked about following NICE guidelines. And a point that I think Sarah Boothby made very nicely is that when Dr. Prague indicated under questioning that she didn't actually understand what Dr. Weir meant when he talked about wanting to look into the cortisol, Maeve's cortisol, and that she didn't understand the relevance of, what on earth he was talking about with anaerobic metabolism. She, in effect, because she didn't understand that, she didn't ask for clarification from the expert on the phone, which she could have done. But she also, in demonstrating she didn't understand those things, she also demonstrated she didn't understand NICE guidelines of ME sufferers needing to live within their energy envelope. Because anaerobic metabolism, right, and that keys into those energy processes. So actually the NICE guidelines are being just not understood by doctors at all, such as Dr. Prague. So Sarah Boothby's excellent point, again, was, well, maybe we need these guidelines to be much more specific. And in fact, this keys back to something that Dr. Patel talked about when he was giving a kind of plan to, I think, occupational therapists to support Maeve on her sort of return home out of hospital. Is he indicated how specific instructions needed to be for the care of Maeve. You can't just say, oh, she needs to pace. You need to actually stipulate and give very, very concrete examples of what that means, i.e. you can only wash one limb a day, sort of thing, and you need rest in between. And it's just, I think what I found so frightening with Dr. Prague's evidence is there was an absolute lack of engagement or a lack of desire to understand what ME is, which, though she indicated that she believes it's a real physiological condition, everything about her behaviour indicated she felt that Maeve's physiological problems derive from her fear of eating, and that actually she didn't really believe her. Let's be honest, from her view, it struck me, Maeve's a bit manipulative. I just, please, NICE, ensure that adequate training is given, and also we desperately need studies, major studies done, because something that came through Dr. Prague's evidence was that one of the reasons she didn't follow through with Dr. Weir's evidence is that she said, yeah, but Dr. Weir is just talking about one case study where his, treatment plan worked. And that's just not compelling. You need to work from major studies. But my question to Dr. Prague is, if there aren't major studies, or if the only one that there is, it's profoundly flawed. If there aren't any major studies, does that mean you discount the sort of next quality of evidence down, even if it's several rungs down, like a case study? Does it mean you discount that completely? Because that's what she did. And she just turned back to her comfort zone of, I don't know, diabetes and endocrinology in the normal population, in relation to the normal population, which is not an ME sufferer. So, yeah, that's all I have to say. I hope this has been informative, and as ever, I'm thinking of you, parents of Maeve. I don't know how you survived this. But all my good wishes are with you. And please, I want to start doing things to put pressure on the government and funding bodies to engage in some proper research, funded research here, because what happened to Maeve and her experience with doctors of the ilk of Dr. Prague, absolutely appalling, not fit for purpose. Anyway, bye-bye.